Welcome to SIG Genetic Podcast 2026. So today we are going to talk about a controversial topic in reproductive medicine, the role of genetics and PGT-A in repeated implantation failure, or commonly known as RIF. So RIF is a heartbreaking diagnosis for couples who have undergone a lot of IVF cycles, and with good embryos, they don't achieve a pregnancy. Yeah, so it's natural to wonder, is there any genetic role or pre-implantation genetic testing plays a significant role in this repeated implantation failure? So we will explore what we understand today, and to discuss that we have Prof. Junhao Yan, MD, PhD, a professor and the chief physician at Center of Reproductive Medicine, Shanghai University. He currently serves as the president of the Center of Reproductive Medicine, Shandong University, Deputy Director of National Research Center for Assisted Reproductive Technology and Reproductive Genetics, Deputy Dean of the Institute of Women, Children and Reproductive Health, Shandong University. A very well decorated credentials on you. Let's start by asking, there's a lot of inconsistency regarding the definition of repeated implantation failure. So how do you define RIF in your clinical practice, and how do you use it in genetic counseling for your patients?
So in clinical work, actually, we find the patients, all of the patients are different. We also find that many patients, they cannot go the baby or for one time, or maybe some of them will do many times of the embryo transfer. We call it recurrent implantation failure. That means in many patients, not everybody can go to one clinical pregnancy for only one embryo transfer. So for the definition for recurrent implantation failure, it's a big problem. For many years, we use the definition is that more than 3 cycles of embryo transfer or more than 10 embryos transfer. So we use this definition for many years. But for nowadays, not every doctor considers a patient for recurrent implantation failure for more than 3 times of cycles of embryo transfer cycles. They will do some therapy. Actually, they will do the therapy or do some examination, also do some tests for only 2 times. And the patient wants the doctor to do some therapy or do some test for only 1 time. So how can we define implantation failure or recurrent implantation failure? It's a big problem. For nowadays, people want to know what's the reason of implantation failure or what's the reason of recurrent implantation failure. So how many tests should we do for the patient? And how many therapy should we do for the patients? It's also a question. So today, I will tell you it's a set method for many doctors want to do is a PGT-A. That means some embryos for this patient, maybe it's not a normal embryos. If this embryo is not normal, it cannot be transferred to the uterus of the patient. Or maybe even the transfer has occurred, it cannot implant in the uterus. So this topic will talk about the RIF, we call it recurrent implantation failure, and PGT. What can PGT do? How can PGT help for this patient with recurrent implantation failure? So this is the topic I want to talk with you.
Okay. So beyond aneuploidy screening for the embryo, do you recommend any other genetic tests for the repeated implantation failure? Because in the literature there are some genetic tests like factor V screening, MTHFR screening, HLA typing. These are some of the controversial genetic tests offered. But in your practice, do you offer this extra additional testing for the couple who are having this kind of reproductive implantation failure? Yeah, what is the role of pre-implantation genetic testing in RIF patient? Do you go beyond aneuploidy screening on the embryo? Do you screen the patient for other genetic factors like factor 5 and other HLA typing, which are not very convincing in the literature?
I can answer this question from some different sections. First of all, not everybody knows the embryo will have some aneuploid disorders. Not everyone knows for the doctors or for the patient. But we have the evidence that in some patients, especially in the patients with advanced maternal age, the embryo is aneuploid. So this is the reason why we do PGT-A for some patients. And we have some publications to confirm this opinion. In many publications, they said that in the patients with advanced maternal age, the embryos aneuploidy is the most common cause of the implantation failure. But in the patients, if this is the mainly causes or the main reason of implantation failure, we do not have enough evidence. Yeah. So we know that for implantation failure, genetic disorders is only one reason. We have other reasons, like the anatomy disorders, like the infection, like the endometrium, like the other things, like immunology disorders. So it's hard for the doctors to conquer this disorder, or conquer the implantation failure. Maybe we should take some medicine or take some therapy from different angles. So it's hard for us to define RIF, and it's hard for us to do only one thing for recurrent implantation failure. Okay.
So with that mixed evidences that you have mentioned just now, what is the role of international societies? Do they give you enough guidance towards the use of PGT-A or other genetic testing for implantation failure? What does the professional society guide us?
Okay, it's a good question. So we have to not got enough evidence for the PGT-A for the therapy of RIF. Many societies already put PGT-A as a method for RIF. We can find from more than 20 years ago, most of the societies said that PGT-A is one method for the people with recurrent implantation failure, not only for the advanced maternal age, but also for the young people with implantation failure. And they have the evidence. That means many publications, they said, we can improve the implantation rate or improve the clinical pregnancy rate or live birth rate for these patients. We have so many evidence for this. The society think it is reasonable for us to do this. And I know even in some countries, they do PGT-A for RIF patients many times, or for most of the patients with only one time of implantation failure. So whether PGT-A is useful for these patients, or maybe we do a little more PGT-A for RIF. Maybe PGT-A can be limited for only some patients or some group of patients, like advanced maternal age, like some people with more than 3 times or more times of implantation failure. It's a question, and we should find some evidence for this, like the clinical trials, like other evidence, we should find this.
So in practice, given that there's minimal RCT available and there's not enough data, we need to do more RCT data generation. When should we consider to do PGT-A, and when should we consider not to do PGT-A? Is it demand driven or it is evidence driven?
We use PGT-A every day for different patients, but it's hard for us to do the RCT. That means if the patient has the implantation failure, if you told him or told her to do the RCT, that means sometimes she will be in the group with PGT, and sometimes she will be in the group with
Non-PGT.
not PGT. So for her, she will say, I only want to choose this group for PGT.
Exactly, yeah.
I don't care whether it works, but I have no other method. So they want us to do PGT for them. They don't care whether it works. So it's hard to do PGT, but we need RCT. So it is hard to do RCT. We need RCT to do this for these patients. So in our center, we have RCT. We have already signed this RCT in the web, and this RCT we will cover more than 20 centers. We do this RCT. We will collect more than 800 patients, and it will last maybe 2 or 3 years to this RCT. We hope we can publish this in the future. We will do this for all
Guide
the.
us towards more management
Yeah.
driven, yeah.
Okay, we can get more evidence for the
So,
guidelines
yeah.
maybe.
So what is the take-home message for patients with repeated implantation failure?
I think we should publish some guidelines, not only for us, I mean for all
That
of
is
the
universally
patients.
acceptable, yeah.
Yeah, we need the guideline for them whether PGT-A is useful for recurrent implantation failure. We need these guidelines, but we still need high score quality evidence for this, like RCTs, like meta-analysis, like other real-world studies for this. So if a patient come to me and ask me whether I need the PGT-A for IVF for the next cycle, I will say that it depends. It depends. If you are a person with a high advanced maternal age, I will encourage to do this. But if not, I will find whether there are some other things which can cause implantation failure first. And if there are no other things which can cause implantation failure, I will encourage you to do the PGT-A for RIF.
Thank you, Prof. Yan. It was lovely, nice talking to you.
Thank you.
And all the best. Yeah.
Thank you,
Thank you
Salim.
so much.